Hello, everyone.
Ready? Okay, sorry. I know that we're now on your time since we've made you wait so long.
Sorry we're late.
We appreciate that. So I'm Miriam.
I'm Ash.
We are current, what are we, second years?
Yeah,
Second years
second
at Kaiser, Oakland, or San Francisco Bay Area. You want to?
Yeah, I know Miriam went to school here, but a little bit about me. I went to Temple, this school in Philadelphia. I'm from Atlanta, Georgia, and then I ended up doing a lot of my externships out on the West Coast and obviously ending up here. So if any of you guys are interested in all the West Coast programs, like feel free to ask me as well after. Just as like a little poll for the group, are you guys like second years, third years? Who's the second year? Second years, okay. Who's the third year? Okay, so are you guys like applying to externships, or I don't know how it works?
It like just started.
Just started.
Okay. Yeah.
The
Okay.
timeline's kind of changed, I think.
Okay, nice.
Yeah.
Yeah. So some of this stuff may be like a little bit seem irrelevant, but we're gonna try to make it like as interactive as possible. Don't want to speak at you for like an hour and feel like this is a lecture. You can speak up, raise your hand, don't raise your hand, we don't care. You can ask whatever you want.
Whatever.
Yeah. Okay.
Okay. How do we? How do we
Clicker.
keep going?
Okay.
Okay. So the reason for this slide is obviously redundant from the first slide that you just saw. On the extern guide, we are listed as Kaiser Oakland, which you can see down at the bottom. But we have kept our OG Kaiser San Francisco Bay Area program logo and that kind of name, I suppose. But in your book, it says Kaiser Oakland. So there are a few different Bay Area Kaisers at this point in time. But our program specifically is the original Kaiser in the Bay Area.
So Kaiser is interesting in that it's like it's a health organization that's also an insurance. So most of the patients that we treat are Kaiser members. That's obviously not all the patients that we see, but most of them are members of Kaiser. And something really good about Kaiser is that all of the specialties were very integrated. It's all within the same hospital system. Whereas you'll see when you go on your other externships, you're going to have doctors who are in the hospital doing cases, but they have their own private practice, or they're just private practice who just come to certain surgery centers, and it's kind of not as connected. But for all of us, all of our attendings are within the Kaiser system. We also work within other specialties that are within the Kaiser system. So not only can we communicate with other specialties much easier, we can discuss our patients with other specialties easier. Our patients can message. They can basically have everything all in one place. Which
it's on
is,
an app.
Yeah, which is not only helpful for them, but also for us. And then we can see what they have been doing, like in terms of their care in all aspects, which you'll see is very, very, very helpful in residency to see okay, this person has recently gotten this vascular procedure, and I can exactly see what they did in this procedure from this off note, or they recently went and got this done in this place, and you can follow along with patients much easier when you have a health organization like Kaiser.
Mm-hmm. It's all in one EMR. All of their care we have access to, so that's very beneficial as far as what's the continuity of care, and that sort of thing.
And something also really nice about Kaiser is that much to the help of all the people before us and the kind of standard that they established in podiatry at Kaiser is very well respected there, which, to be honest, you'll see on some externships that it's not always that way. And I feel that Kaiser has a really good relationship with ortho, and things are very stratified, where all ankle fractures will always go to us, the easiest one and the hardest one. There's no question or kind of back and forth between ortho and podiatry, and that's something I think is really helpful in our education, is that we don't, it's not that we're only fed the really not so great patients or the not so great cases. We really see everything that comes for foot and ankle, and I think that's what makes this program and make all of us, really able to handle anything.
So what is residency? Obviously, it is the 3 years that comes after the 4 years of medical school. No residency is the same as another. That is one thing about our specific specialty, that it has its pros and cons. That the standardization education as far as what we're exposed to, what we get to do. It differs by state. It differs by program within the state. It, as far as your scope of practice and what you legally are able to do versus what attendings might feel comfortable pushing the boundaries of. California is a state that we have a particular attending that will drop nails like from the tibia down, so that's not questionable. Like it's a reasonable thing to do in the state of California, and specifically at our residency program. If you feel comfortable doing that, it's cool doing it. As you get out onto your externships and you're starting to look at for the third years and looking at what programs you want to go to, even when you're just reading through that manual, every program is extremely difficult or different from the next. And so really trying to pinpoint what you want out of residency it's a very, you gotta look at yourself and what you want and what your expectations are. And there is a residency program out there that will meet those expectations. So that is whereas things aren't necessarily as standardized within podiatry, the fact that they aren't, there's something for everybody. But in general, of course, it's just a 3-year hit the ground running, work as hard as you want to work, to get as much as you possibly can within that amount of time. And then potentially, whether you want to do a fellowship or not, technically after residency, you're able to do whatever it is you want to do. But the residency, that training is extremely important as far as bridging the medical school education into what you're actually doing in practice.
Yeah, I think you had a question, right?
Yeah. What would you recommend, as P3 is going in, what would you recommend? Like you said, every residency program will fit you and will provide for what you're looking for. But do you have any advice to, what should we be looking for?
We got a slide.
Okay.
We got a slide where we'll talk more about externships, and we will definitely get into that because that's extremely important, especially for this group of people right now.
Yeah, no, and very, very, very good question and things to be thinking about. And that I think sometimes as a student, at least for me, right, that you've worked so hard, you've all done the absolute most your whole lives to get here, and then you're oh my gosh, well now I gotta make them love me, whoever will take me. But remember that you worked really hard to get here, and you are also interviewing them, so these are your 3 years to get the most that you want out of it. Different people want different things, and that's completely fine. But like she was saying, you to recognize, okay, do I want a really surgically heavy program in this specific aspect? Do I want a more wound care heavy thing? Do I want a more clinic heavy thing? None of these things are wrong at all. But to know that, okay, well, I also need to choose a place that's good for me, and it's not just about how, oh my gosh, well, whoever will take me, oh my gosh, they just need to think I'm the best, and oh my god, you will have your choices if you have worked hard, and if you're here on a Friday evening listening to us talk, I'm sure you will all have your choices.
You're probably pretty dedicated.
Yeah, so residency is the time that you choose the environment that you want to be in to make the rest of your life, because I think in medicine we're always so taught well, there's another step you have to do, and then after that there's 3 more steps you have to do, and then after that you might get what you want. But take your choice of where you go on externships and for residency, you're no, take it intentionally, you did all this stuff to get here, and you should be choosing the places that are best for you. And sometimes it's not necessarily the names that you're told are the best or whatever, in your classes. So like she was saying too, it's just 3 years, which it can feel very long when you're in it. But in the grand scheme of things, as pre-meds, we dedicated basically the decade of our life to this. So like I was saying, just take your choices seriously, and don't think that you need to do what other people are doing / what other people have told you is best. Really, really take these decisions.
Be honest with yourself.
Yeah, be honest with
only
yourself.
Focus on yourself.
Yeah.
Not anything else.
Yeah, and in our 3 years, at Kaiser specifically, it's a very, very surgically heavy program, which we'll get into that. And that's something I think that works for both of us very well, but it's also like very work hard, play hard, which is something that I personally wanted out of a residency program. Like, you don't just work this hard just to work this hard. Like, you want this to shape like the rest of your career and your life. We're really lucky in that we get to be in one of the best cities ever. I mean, I think Chicago, being here for 6 hours, is such a great city. But my heart
the weather
is in San
way
Francisco.
better in San Francisco.
Yeah. But really, like, there's, don't discount location to when picking a residency program. Like, you got to be happy in and out of work, and you got to choose a city where like you're gonna feel like you're actually living your life still. So in San Francisco, I live in the city, which I love so much, and this is my view every day. Top left, not really, but almost.
Not Golden
the
Gate,
other
it's
bridge,
the other big
the other
bridge.
bridge.
The Bay Bridge.
But I spend a
Her
lot of my
apartment's incredible.
I spend a lot of my weekends when I'm free. I go to Napa. I've been, can't speak. Lake Tahoe, skiing. There's so many great like sports events that we get to go to. There's just San Francisco is such an amazing city, and if you guys do end up coming there or ever want to visit there, like it's just one of the greatest places to live. And you want to talk to me about where you live?
Yeah, so I live in the East Bay, so not Oakland. I live even further east of there. I live in Walnut Creek, which I think our next slide. Yeah, so this slide here covers those 3 stars are where are 3 different service areas that we cover within this residency program. Like I mentioned before, there are other Kaiser residency programs within the Bay Area that are like more South Bay, like Santa Clara is one, and I think they like cover Fremont as well, which is just like northeast of where Santa Clara is. There's also Kaiser Vallejo, which is in the North Bay area. But as far as the area, like between those 3 Kaiser programs within the Bay Area, who covers the most ground, that would be our program by far. So we cover San Francisco, we cover Oakland and Richmond, and then we also cover what's called the DSA, or the Diablo Service Area, which includes Antioch, Walnut Creek, and Dublin, so all like pretty far East Bay. I live in Walnut Creek. It's more of a suburban type area. I'm not super big on cities. I'm from the middle of nowhere in Kentucky, so like cities are kind of daunting to me. And it's like really warm in Walnut Creek. It's always sunny. It's usually like 90 degrees, and I love that. Whereas the Bay, it's much more temperate. Like between like 60s. I think people start like really sweating when it gets to like 75 there. Yeah, so I picked Walnut Creek just because it was like a little bit more my speed, and the weather is, in my personal opinion, better. But no matter where you are in the Bay, it is way better weather than Chicago. I'll just say that.
Yeah, and in general, like there's kind of something for everyone.
Yeah.
Like, for people, if you want to live in the city, if you don't want to live in the city, if you want to live in Oakland, we've had past residents live all the way up in like San Rafael. Like there are different,
something
there's something for everyone. But kind of the main thing too in this slide is that always remember, you guys going to schools near a big city, you see this too. Like location is also not important just for your own personal life, but also in the diversity of pathology you're going to see in bigger metro city areas. Like you are going to see the poorest of poor person and the richest of rich person, and they're going to bring very different experiences for you. So in San Francisco, I'm sure you've seen.
Yes. So where do we go into the? Well, at one point we get into like what it really looks like between first year, second and third year. Now that we are second years, we do 4-month blocks at these 3 different service areas. I'm currently on my San Francisco block. She is in her DSA block. But so this is like the first real experience that I've had dealing with the San Francisco population. And as a first year, all of the podiatry is in the DSA. And so just since I've had that comparison, it is extremely different, not just the patient population that I'm dealing with, but just the overall culture, the hospital culture, what services you're really working with. Like, I'm essentially an orthopedic resident in San Francisco, because there are no orthopedic residents at Kaiser in SF, so I have a much different experience in San Francisco than I had in the DSA, or that Ash is currently having in the DSA, and it's also very different than what we will ultimately experience when we cover Oakland. But we get into more of those details a little bit later. As far as who we are, like as far as residents, these are just pictures of previous classes. Obviously, we are forefoot and rear foot credentialed. Not all residency programs do rear foot, so be sure you pay attention to that. If you want anything to do with the rear foot or the ankle, you need to go to a program that actually works in those things and is credentialed to do so. Most residency programs these days are, but there are still some out there that are just forefoot credentialed. We have 3 residents per year, so a total of 9 of us at the residency at any given time. There is a misnomer, or kind of like rumor, I suppose, that the California residency programs, specifically those in the Bay Area, really favor the California schools, whether that's Western or CSPM or Samuel Merritt. It's not true at all. Obviously, I'm from Shoal. She's from Temple. Our co-resident is from CSPM, but we have residents from Kent. We have residents from the Arizona school. What's that one called? Midwestern. I don't think we've ever had anybody from Florida, but like you are not excluded from California by not being at a California school. That's the main point. And we really like teaching. We like helping the students, further just like their academic goals, help them figure out what it is that they like about the program, what they don't like, things that they are good at, or what they could work on. So we don't just have you sit in the corner and not talk to you. So we do enjoy the student experience and enriching your experience as well. Yeah, you go ahead.
Yeah, and we're really lucky. We have a lot of really great attendings at our program, like some of the big names in podiatry and really like OGs in podiatry, and getting podiatry to be a much bigger surgical field. Like, we've had obviously Dr. Schuberth, which I'm sure most of you guys have heard of. Dr. King is huge in education and podiatry, and we're lucky to have her as our director. Most of our attendings are also graduates of the program, which is, I think, it's really great being taught by alumni and really having like such a strong foundation. And in that way, we're also passed down all the teachings from these kind of OGs that taught them, and really big names.
But they all think very differently. Just because they trained at this program, so Dr. Coleman and Dr. Patel, they are the 2 original graduating residents from the first class of this program. When I was externing there as a student, I was given some presentation. They got in a pretty heated argument about what their various principles behind why they treat this certain thing this way versus the other one was just like, I don't understand at all why you would do it this way. This is why I do it this way. And so even though they train together, they train residents together, obviously they still work for this program. They have very different ideas about how to treat things. And so even though, you'll hear this notion inbreeding or whatever within some of the residency programs that the attendings train there, now they teach there, at least at this program, even though there is that level of inbreeding, they are very different, and how they manage things is very different. So it gives you the experience of working with a lot of different minds, and then you just get to accumulate what it is that you like, what you don't like, and I think that helps make you a better surgeon and practitioner in the future, just having that exposure.
Yeah, I agree with that, and that I think I learned throughout my externships, like I definitely wanted to be at a program where we learn from a lot of different attendings, which you'll see that's not always the case. Like sometimes there's really only like 3 main faculty or something like that, which works for some people. Like that way you're kind of taught to do things 1 or 2 ways, and that's the way you do them, and like there's no questions. But I do also enjoy that like there's a lot of like back and forth discussion on really everything that we do there, like on all academics, on all journal clubs. And like it's good to know that you're in an environment that's like trying to always like be cutting edge, right? Always questioning why we're doing things the way we're doing things. How can we update the way we're doing things and do them better? And like a lot of our attendings are very heavily involved in research, and that's something that to look out for in your externships too. Like are these attendings actually like walking the walk, right? You can all say like we want the best of the best to come here, but unless like they're also involving themselves in research that's pushing the field forward, attracting those same kind of minds, then it's important to look at that stuff too. And I think our program does a really good job about that. And also just big leaders in the field. We've had a lot of former ACFES presidents, and also we're lucky to have one of the biggest names in like pediatrics and podiatry at our program, Dr. Williams. So just really like great big resources that I sometimes forget, like, oh, if I had gone anywhere else, I probably never would have seen clubfoot, or maybe I never would have seen like this kind of TAR, blah, 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 so just things to watch out for when you're going through your externships. We love talking about money.
Everybody cares, okay? Now that, I mean, obviously when you're students, you were, and you're externing, you were paying to be there, which is just always pissed me off as a student. But as a resident, we are one of the highest paid residency programs. Granted, we are in one of the most expensive places in the country to live, but we are comfortable. We are not stressed about money. Obviously, our salary goes up a decent amount each year. And with our being a third year, or like during the third year, you have what is called the chief salary, even though there are technically 3 different chiefs. So there's not one chief for the entire residency as a third year, which you will see that at some programs. Since we cover 3 different service areas, and there are 3 different groups of residents going through those different service areas, at each one of those sites, the third year is the chief, and therefore that allows us to get Kaiser to give us more money as third years. So that's a benefit. This slide just goes through a lot of the educational and medical benefits that we have associated with our residency program. Ultimately, it comes down to you get a lot of money for travel. We're here for the ACFAS Scopes course. This entire weekend is covered for us to be here. Next month we are going to the AO workshop down in Redondo Beach. I'm also in the works of trying to go to I think it's in Atlanta, the advanced AO course that is now going to be in December, that one of our we have faculty teaching at all of these courses. So that's another course that I haven't even told you that.
Oh my God,
Yeah, I know. Hopefully we'll get a third course approved, which that's a lot for second year, so we go into 3 different courses in 3 consecutive months.
Yeah. It's not always like I was talking to some of my friends from school, and they were like, "Oh, your program actually pays for that stuff." I was like, "Oh, yours doesn't." Like,
yeah,
I didn't know that was a thing. So it is like it's
a big deal. Yeah, it's a big deal. We also have had several textbooks and our what is that? The video course, Foot and Ankle Surgical Academy. That's our membership for that's covered. Big thing, bottom. What is that? Right. Personal lead, huge deal. You get to design it. We have our personal lead. I love it. It's awesome. I'm so excited every time I get to wear it. It's like $1,000. It's no cheap thing. That if you actually get your own lead and you don't have to deal with we always say the staph infections that you get if you're using community lead. So there are a lot of benefits, a lot of educational funds, housing funds. So there is this $8,000 it's now split, so you get half of it at the beginning of the year, half of it January-ish. So you get $4,000 and $4,000. That's a nice bump in the middle of the year that helps to offset the cost of living in the Bay.
You also get free healthcare, which is something
fun.
I don't think you or think about when you're a student, but that's actually like a really big deal. And because if you're paying for your own healthcare
and for your spouse,
and for your spouse,
significant other,
and we're talking
good.
like you pay nothing, nothing. And that's a big deal. Usually, like you're paying hundreds of dollars for healthcare insurance and dental insurance and vision insurance, and goodbye to all of your monthly income at that point. Like all these things add up. And so while I don't think at any any residency program in general, you're ever going to feel that you're paid enough for the work that you do. You never will feel that anywhere you go, even if you're in the cheapest city in the whole world. But like other things like this are what actually are the real benefits. Free healthcare, having a gym fund or a wellness fund, you can spend it on whatever. I don't spend it at a gym.
I don't spend it at a gym. It buys my wine.
Yes. And like the housing allowance, which again, you can spend, that as you want. But it really does help to offset like the real costs of living, that you're, living in an expensive city. It's nice that we don't have to worry about that.
So. Oh, you also get an iPhone, you get a laptop. I mean, it's like a what is that, HP? But I mean, we got like up-to-date iPhones and all that stuff. But your pagers are still out of the 1960s, so that will never change.
Yeah, and all of like your board prep stuff, and like we talked about, education funds and conference funds, like that's all covered.
So, like I said, we would talk briefly about what the actual year-to-year breakdown looks like at our specific program. This is one thing that varies significantly from program to program to program. There is, of course, certain off-service rotations that you have to do for CPME accreditation. All of our off-service rotations are done during our first year, so pros and cons, like anything, there's pros and cons. So with the first year, we only have 4 months of podiatry. All 4 months are done in one service area in the DSA. That is the busiest service area since we're covering 3 different hospitals. So at any given time, we have 4 residents there. Because we also, in the DSA, this is where things get hairy, in the DSA and in San Francisco, St. Mary's residency program, they need help getting their surgical numbers. We need help managing our numbers because our load is just too much for 9 residents to handle. So in the DSA, we have a 3rd-year St. Mary's resident at any given time, and they do a 4-month block during their 3rd year in our DSA program. Another one of their 3rd years does a 4-month block in the SF rotation. So we have 2 St. Mary's 3rd years in the DSA and in SF. And then they also have to send a 2nd year to SF, intermittently. But the DSA, that's the busiest. That's why we are there as first years, so that we are at least with either one of our 3rd years or a St. Mary's 3rd year during our intern podiatry service. It's not a 4-month block. It's broken up either like a month and then 2 months and then a month, or it just varies based on the schedule and all the other rotations. But we go through all of the main services that CPME requires. Some of the most beneficial are orthopedic surgery, of course, vascular surgery, infectious disease, unfortunately. If you like infections, infectious disease is very, very important to understand and be good at. General surgery is actually not a requirement by CPME anymore, so we have gotten rid of the general surgery rotation, and we now do something called orthopedic subspecialties. And it's pretty much a month with Dr. Williams doing pediatric orthopedics. We also do some sports medicine / ortho, like ultrasound guided injections. There's a very good musculoskeletal sports medicine doc in Oakland that we work with during that rotation. So it's kind of a mixed bag, but a good experience. And then you just have all your basic things that you have to do because of CPME. Then 2nd and 3rd year, you have the 4-month blocks at each of those 3 different service areas, like I already mentioned. And specifically, one thing that stands out about this particular program is the San Francisco block. As I mentioned, we are the orthopedic residents there. Now that I have experienced the San Francisco block block. Like anytime that you're on call, you are doing pod and ortho call. Pod call in SF, like compared to the other services, it's a joke. But this has been some of the hardest call I've experienced so far in residency because of ortho. I do hip nails, I've reduced elbows, I've reduced shoulders, wrists, tapping knees, wrists, shoulders. I had several tibial plateau fractures. One was an actual compartment syndrome, did fasciotomies on that. That was a couple weeks ago. So that experience it stands out from anywhere that I rotated as a student. No other program, and I went to very good programs, no other program had that experience. So that was one reason why I really liked this program in particular. My ultimate goal is to end up in an orthopedic practice. So having that experience, like being able to deal with orthopedic surgeons, talk to orthopedic surgeons, have some sort of understanding and respect from the fact that when I'm logging these orthopedic cases, whenever I do apply for that job at whatever orthopedic practice I'm trying to get into, within my 8 months within San Francisco during my second and third years, hundreds of orthopedic cases. And so that, I really do think that is one major difference between this program and a lot of others. We also have a decent amount of clinic. Generally between those 3 service areas, you'll spend 1 to 2 days in clinic. The rest of the days are in the operating room. Like Ash was talking about earlier, you really got to think about what you are looking for in the end, like what your ultimate practice goal is. Like if you want to be doing more clinic, if you want to be doing more OR, if you want a healthy balance. The benefit of clinic, at least at our program, is we are seeing things preoperatively, we do the surgery, and then we follow that patient postoperatively, at least once we get to our second and third year and we're in like that block setting. So I get to follow the ankles I do, I get to follow the Achilles I do, I get to see, I had an Achilles tendon repair that he had this little tiny, really small early pressure injury to his anterior tibial tendon, so that skin, because I was splinting him when he was prone. And as you wrap around the back, whether they're prone or supine, you wrap around the back, there's always more tension on the back. And so it showed me, oh, okay, like even web roll can cause an early pressure injury. I had 2 more Achilles yesterday that I did. And I was very acutely aware of that, making sure that I was ripping the web roll appropriately around where that where the anterior tibial tendon is. So there are benefits certainly for clinic. I do not think there's much benefit for students in clinic. That's my personal opinion. Our externship, we do try to get you into the OR pretty much all the time, because I think that's where you can grow the most, and you need to get comfortable in the OR, which takes time rather than like clinic. Like you can learn clinic, you do clinic as students. So. So we have trauma clinics. Sure, we do a little bit of wound care, not very much. So if you like wound care, this is probably not the program for you. We don't do much limb salvage either. So those are things to think about, like when you're trying to think about what you like, what you're looking for. These are just, pictures of a lot of the various types of surgeries that we do. We are very trauma heavy, lots and lots of ankle fractures. Calf fractures, Lisfranc's. We also have a good amount of total ankles. I do think that's a place that we could improve, but the more exposure I have in residency, and as I think back to being an extern, it was very rare that you saw a resident doing even like 80% of a total ankle. It is a very complex procedure, and I think that was something that I was a bit misguided about when I was a student. I was like, well, why aren't these residents doing these totals? And so then I would think a bit more negatively about that program. But ultimately, it is a very complex procedure. The risks are very high. People lose their legs if these things fail. And so, like, being with and attending, like Dr. Schuberth, I mean, he's a legend as far as total ankles go. He trained the attendings that we now have that are doing the totals and just assisting in those. And once you get like later into your second year, into your third year, you will be doing some of the total, but never expect to do 100% of a total as a resident. I would just say that as a baseline. If you are really into totals, that's something that, you know, like in the orthopedic world, they're joint surgeons. I think that is also applicable in our world. Like, I'm interested in doing a fellowship to get more total ankle experience where I'm actually doing those. But I do know that this program, I will be comfortable enough going into fellowship to, you know, start really honing those skills as far as total ankles go. Otherwise, I mean, lots of tendon work. We do have a couple of attendings that do Charcot. I'm not big on it. I don't know how you feel about it. I don't want that mess at all. But a lot of trauma, yes, you get your infection cases because that's just run-of-the-mill. You have to do that. But a lot of elective, reconstructive type procedures as well, flat foot recons, cavus recons, bunions, toes, like whatever. We do all of that.
Yeah, it's just kind of crazy how, like, in the past maybe like 1.5 weeks in the site that I'm at, we've already seen 2 talus fractures, 3 calf fractures, 4 Achilles tendon ruptures, 1 million people come in with infections, and like that's you know, for now it feels like, oh my gosh, it's kind of annoying, like please go away, but it's like, wow, no, many other programs, they are like, don't even see 1 ankle fracture in like a month. Mm-hmm. And so that's
definitely not calf fractures are a bit more rare.
Or maybe
like we have regular calf fractures. Pretty darn regular. This slide here, these numbers won't mean much to you at all at this point in time, and whether these are necessarily like up to current data, I'm not sure. But the left-hand column shows you what CPME requires. The far right-hand column shows you how many more cases we do than what is required. And main point, it's a shit ton more. We do a lot of surgery. Academics, we are also a very heavy academic program. I also don't think I necessarily knew exactly what academics meant when I was a student, when, you know, like at my point in time it was Dr. Jarrett who was making these recommendations. Now it's Dr. Jaffe, which I think is great for you guys. Like a heavy academic program means that they enjoy teaching. They have a lot of required teaching time or workshops and like those kind of things. So I mean, we do journal clubs. We have sawbone labs. Like last month, we had a striker came in for a ankle. Was it? Oh no, it was of like forefoot. We did like DMO, lapidus, and something else like sawbones using striker stuff. Then the next week we did an ankle fracture, like various types of ankle fractures, different like plating constructs, like that kind of lab. Again, striker, sawbones. We do cadaver labs down in Fremont at the Arthrex Center. We've had Paragon bring their truck up, do just any kind of cadaver lab when they came up to San Francisco. Usually each month so every Wednesday night we have academics. Then they're based on the site are like intermittent additional academic things. But attendings give lectures. We also just this year added a Wednesday academic half day in Oakland, which is protected academic time where the attendings are teaching to us rather than some of our academics, or a lot of our academics rather, are residents preparing like case presentations, like going over various surgical cases that we've done recently, and that just adds more work to the resident. So we added some more attending teaching time because that's also very beneficial.
Because like in school, I know it's like you're like get annoyed about having so many lectures, but you'll soon start to miss actually being able to
being lectured at.
Yeah.
Rather
like,
than you giving the lecture.
Teach me, please.
Yeah.
But like having an opportunity to just like learn again is just, it feels good.
It does feel good. It does feel good.
What was your question? Yeah, the radiology rounds, those are in the like lunchtime, I guess.
Lunchtime
it'd be
Wednesday.
Kind of lunchtime here too.
12:30 there, 2:30. It'd be 2:30 here, but
Yeah.
they are recorded, so we can. If you will get me
Yeah.
the email addresses for everybody, and then we can send the link that it just like comes to your calendar, and you'll get reminders like every Wednesday. We do record those, and you can watch it. I think
Yeah.
for a few days after.
It will be some, like, usually it's not you guys that will be doing the cases, usually like the externs that month, but like you might be involved in like talking through some cases or like reading x-rays, things like that, which is, not like it is a scary thing as a student.
You'll get great practice here.
Yeah.
Okay? Our radiology course here is...
But there's only one way to learn.
It's
honestly,
up here compared to the other school. I'll just say that, no offense. Sorry.
It's true, yeah. But like there's only one way to learn, and that's by like literally like doing it on the spot.
Mm-hmm.
And so I do encourage, if you ever have the time to log on to radiology rounds, because it always is noticed to like people who log on and are consistent about that. So
yeah. Okay, skills, sure. I already talked about all this. Those are just some pictures from other XFix labs and such that we do. We also have through the year, so we have 3 teams of residents, a first year, second year, and a third year, make up the 3 different teams. It's just a fun, like competitive type thing that we do amongst the residents. We do include, if you come as an extern, you will get to experience at least one Olympic event during your month, and so we're accumulating points through the year at each of those like various labs, like who puts the best XFix on, like who builds the most stable pylon fracture construct, whatever. And then at the end of the year, that's like the actual Olympic Games, and we're in our teams, and it's just a race, like station to station, doing like suturing. I don't know, what are the different stations?
like Achilles repairs, putting on plate screws, things like that.
Yeah, and then whoever wins gets like this little trophy. It's just something we do. We obviously, like I said, there's a lot of room for sending the residents to these various educational courses. There are some programs out there that they do their own academics and their own educational courses, and they don't send their residents to, like the annual scientific conference that ACFAS puts on, or like you don't go to the ACFAS Scopes course or the IFAF Scopes course, you don't go to the AO courses. So that is something to, like, if that's important to you, I do think it's very important for networking. Like personally for me, there's some fellowship directors at this course that's this weekend that I'm planning on meeting and like initiating that networking experience. It's just good to also just like see your friends again and like reconnect, and like all of these things are like little mini reunions, and they're great learning experiences, and not every program facilitates going to those as well as ours does, and some programs do it better than we do. So that is one thing to also think about. Also relatively research heavy. We have a lot of research historically in our program. I think COVID certainly threw some wrenches in previous graduates, like more recent graduates' research accomplishments and achievements. I currently, myself, am on 3 different research projects. One is a total ankle revision project with Dr. Schubert. One is a fibular nail project with Dr. Pollard and Dr. Dickinson. And then one is a MIS procedure or a MIS research project with Dr. Lee. How I'm going to do those in the next year and a half, probably not feasible, but I'm at least starting these things for the people to come. She has a very good research project also right now.
Yeah, I'm working on like a Liz Frank research project, and we're lucky that in Kaiser we have such a huge database of patients like that we can pull our research projects from, that it makes it super easy because we're also given research coordinators through Kaiser itself. So they're the ones who help us with a lot of like the data analysis and like statistics of it all, the stuff that I don't want to do. So like we can actually just focus on like thinking about what's a great idea. We have the patient do we have the patient population to study it, which is usually yes. and then they can help us with the kind of more technical stuff, and then of course, you know, like we're obviously responsible for writing the paper at that point, but having that kind of tool of a research coordinator is extremely useful.
I didn't think that, I mean, I really don't like research. I didn't like it as a student, never really cared for it. Don't think I'm going to do it in the future. But having those resources to make it easier, especially if you're like not necessarily research oriented, it's cool. It's important.
And then we have a summit every year where we all talk about our research project and give updates on what we've accomplished in that past year. This is also an opportunity for students to come and present their research. So if you guys are ever interested, you should apply to this, and you would fly out to California and be the same place we all are, and we're all presenting our research together.
Is that covered? Like, was it covered for you?
If you're ever interested and you want to do that, you can talk to me. I did it this past year, and it was completely paid for. So it was a $1,000 stipend.
Yeah, it's amazing. Perfect. And then, it's also a great way to network, like she said, and meet people, and not just our program. If you're interested in any of the other Kaisers, like all the Kaisers come and do this together.
So we also have several mission trip opportunities. June, Matt Kennedy, he's now a third year, went to Poland with Dr. Williams, doing like pediatric various deformity reconstructions for a week. There's also Operation Rainbow, which is similar, where you're going to a third world country doing deformity correction. I'm not familiar with what this one in Vietnam is. Are you familiar with that one? I'm not familiar with that one. Maybe it's a thing. Maybe it isn't. This slide here, the younger guy, that's Fernando. He graduated 2 years ago. He was a third year when I externed there as a third year. He did a mini AO fellowship in Switzerland. He had a great experience. It was like 3 weeks of his third year, and that was all covered. So there are various educational opportunities. I think the main point is, if there's an opportunity that you are interested in, this is a program that helps facilitate making those things happen, whether it's something that somebody's done before or not. Sure, Ash already said it, work hard, play hard. We do a lot of things together. We stimulate the family environment that the residents and the attendings. We support each other. We do a lot of things together off the clock. Dr. King takes us to Giants games. What's the basketball team? Oh my gosh. The Warriors.
Thank you.
We go to Warriors games. She was trying to take us to a 49ers game last year, but something happened. But usually you go to all 3 of those major sport events, at least one game a year. She gets, like box seats for everybody. We also
every week too, after academics, we always go out to
the residents go for like beers and stuff. Yeah.
And that's something like no matter what, all the students come to that too. And I think it's also important to see how do these people actually interact with one another. And not that everyone needs to be best friends or anything, right? But you got to have a good working environment, because the way that people are treating each other is often the way you'll be treated if you go there. So don't discount that, So I think our Wednesday nights out are always really fun. It's our time to just not have anyone else around, not be at work, and talk about the real things.
Yeah, talk about the real things. Yeah. Family environment, people have kids. You got anything else about that? Yeah, okay. And yes, just enjoy your time. Enjoy, I love school. I loved externships. For the most part, I've loved residency. It has its ebbs and flows. You have your good days, your bad days. Ultimately, be in a place that is supportive of you, that is stimulating what it is that your end goal is. And it's not so bad being in the beautiful state of California. Don't we have an externship slide? We do, don't we?
I thought we did, but we can just work with it.
Oh, yeah. There it is.
Yeah, maybe let's just.
Sorry,
stick
we're
to
we're
that.
like this. We're
It's
taking
really
forever.
long.
Residents work wherever it is that you want to work. A lot of them stay in California, but like this slide shows, people go elsewhere as well. You don't necessarily have to stay in the Kaiser system. Some people do. I personally don't think I would want to. Just, you know, I want to be, like I said, private orthopedic practice. Major con, the driving that we have to do because we cover 3 different service areas. Unless you want to move every 4 months, you're going to have one commute that is super easy. Like I can be at the Walnut Creek Hospital in 4 minutes. I can be at Antioch in like 20, you know, like, okay, Oakland, 20 minutes, going to the city. I hate my life right now. She has the reverse. Like she could be, you know, so she hates going to the DSA. It just is what it is. But one good thing about the amount of driving that we do is we very, 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 very rarely, unless we are on call or it's like a Wednesday academic situation, ever have to go between different hospitals in the same day. Like you're not like bebopping around from like the surgery center to the hospital back to another hospital. Like there are programs like that. If you're in Antioch for the day, you're in Antioch. If you're in Walnut Creek, you're in Walnut Creek. Like it's at least not driving in the middle of the day. And yes, it's expensive, but my husband calls it the membership fees. Like again, California, okay? Lots of strength, so many words. Sorry. Academic heavy, lots of trauma, lots of reconstruction, tons of surgery. Yes, you get your clinic. You get to, you know, follow your patients through at least like, you know, their initial post-op course, which, like I said, is very important. It's a great place to be. We like supporting each other. We have a good time. Yeah, we're stressed, we're tired, but but we have a good time. That's the main thing. All right, externships. Does the question sheet have questions about externships specifically that you guys are?
Because I know we have a bit of the third years. Does anybody have any particular questions?
Yes.
So we have our like clerkship fair on Friday, and
Mhm.
obviously we're leaving for externships soon-ish.
Mm-hmm.
So what do you think are the most important like piece of information that we should make sure we get from each of these programs while we're there in order to make a good decision?
So before you even talk to the program, be sure that you've read their little handout in the booklet, okay? If you're looking at that and the program is not doing the type of surgeries you want to do, or they don't pay enough, or it's in a place that you're not so interested in, nix it, okay? Obviously, that's like where to start. Once you get it down to like 20, 30 programs, then you start, do some research. Like, just Google them. Like, look on Instagram. Like, a lot of these people and a lot of the programs are on Instagram these days. They're posting things that they're doing, what their residents are doing. If it looks like a place that, I would like to do those things, put that on your short list. Then once you're, like, I don't think I ever actually, our clerkship fair was virtual at that point in time. Going in, is it in person or it's in person? And so that format, are they like, is it more just a fair where you're like going around the tables?
Yeah.
Okay. Did you have one of those? That's a very weird situation. Because like you can't really like dig into like what obviously they're not giving you a presentation like this. They're not really giving you any kind of notion as far as like what they do, their strengths, their weaknesses. If there is something that you absolutely know you want to do, so if you like limb salvage, or on the other end of the spectrum, you're like really ortho oriented and you're really into like totals and reconstruction, that sort of thing. I think the most beneficial thing would be before that fair, look at who the attendings are and what they say that they do. Yeah?
Take a note of who the directors are. Your director is extremely important in any decision. are they well connected? Because essentially at the end of the day, we can do everything right and perfectly in the world, but if we're not well connected, we're not in the right place at the right time, it doesn't always add up. So are your directors well connected, and are they a big
and are your faculty well connected?
Yeah, are the faculty well connected? Are they a big presence in podiatry? What is the main focus of the program? Some salvage, trauma, whatever. How many residents are at the program? Do you want to be at a resident that has do you want to be at a program that has 1 resident per year, 2 residents per year?
Big deal.
Or do you want to be at one that has many? I do think it's important to ask what your call schedule will be like. Obviously, I don't think that's like an appropriate question to be like the first question that you ask people, but like this is life, and that's going to be important. Location is important, like I said, not only just for where you're going to be happy, but are you going to get the diversity in the pathology living in the middle of nowhere? Probably.
And you might have a lot of like farm injuries.
I mean, but you know what I'm saying.
And a lot of diabetic stuff. Being from Kentucky, I do know that that's the case.
Yeah.
But you might not have as much elective stuff. You know, you probably aren't going to be doing very many ankle scopes. Probably aren't going to be doing many, like reconstructive type procedures in that type of patient population.
And then just like when you're at your externships too, which we'll get into all this later as you guys have more questions, but like write things down as you're going through your externships in your little notepads that you keep, like not just about like stupid studying stuff, just about like how did I feel, and then
spreadsheet. Make a spreadsheet.
And what, because when you're 6 months in and you've been at all these programs and all these places, and you're like, I don't remember how I felt there. I think I was fine. I don't know though. Like, just keep a note of that stuff. Because let's be real, these fairs, you're gonna just hear everyone say it's amazing.
It's
so great.
I did not get much out of the virtual clerkship fair, except that there was a program that I was quite interested in, and the residents were golfing during like their conversation with us, and I was just like, man, like sure, I love golf, I would love to be out there, but like come on now, like you can't take 5 seconds to be serious and like actually like focus on the future of your program. So I didn't like that so much, but at least in this situation, like you obviously won't have people that are golfing. Really, like just see if you even like them. Like when you're talking to them, like, are they weird? Are they like offering a lot of information? Like the more somebody, like I'm talking at you a lot right now, and like I do this to the students when they come as externs too. I just want to give you as much possible information as I possibly can to help you make the best decision for you, whether it's this program or some other program. And to like, because ultimately to be the best resident that you can be and to be the best practitioner that you can be, you need to be happy where you're training. And if you're not happy where you're training, you're not getting as much out of it as you could be if you were somewhere where you were happy. So having someone, like if you're talking to these directors or other residents, whoever it is that's there, and like they are actually engaging you and they want to answer your questions, and like I think that shows a lot more than like, okay, here's a handout, thanks for coming, you know? So what the proper question is, it depends on you. Like what you're most interested in, what your burning questions are. But do your due diligence and do some research before, so that you at least can like prioritize the different booths that you're going to and have some notion of who it is that you're talking to.
I'd say after you're done with this whole process and like closer to the end of it where you're interviewing and you have a little bit more, I don't know, clout with programs that like want you as well, then it's probably a more appropriate time to start asking more like hard-hitting questions about like, hey, what was some like feedback you got from residents and how did you change your program because of that? Like what were ways that you've adjusted over the years? Like how have you evolved? Like then you can probably get a little bit more into the weeds of like, okay, like, I put in my work, I want to pursue you and I can feel you pursuing me, but for me to make my decision, I would want to know like a little bit of like the deeper stuff. But I would say at these fairs, you're not gonna get
the deep stuff.
But when you get to that point, like, you know, obviously as long as it's appropriate, like ask questions like that, like what were some difficult situations that you've been through and what'd you do about them? Because they're asking you that stuff, right? So
I think also initially you need to be like, okay, the general breakdown across the 3 years, like what we covered. How much time is off service? She was just talking to a friend of hers that has a completely different experience than we have, and we did the math, and it's like a total like 15 months total across 3 years of podiatry. That's it. Like, that's just mind-boggling to me. And so with us, like, all the off service is done first year. You get 4 months of podiatry, which it sucks. You forget a lot. Like, I was so smart when I graduated from this school, and I forgot so much during my first year, and like now I'm like, you know, really trying to get back on track with that stuff, but it comes back. And so then second and third year, it's all podiatry and it's ortho. Like, there's no off service. There's no like putting your mind towards anything other than what you are actually going to be doing in your future. That's a great thing to know about a program. Like, if you're doing off service stuff as a third year, for me personally, I don't want to be doing that. The call, like Ash mentioned, the call schedule, not necessarily the call schedule at this point in time for you guys, but if they take call every year, or if it's just the first year. A lot of programs, a lot of our friends, they are now done with call. We are not. It is ramping up. Our program, like it's very light call as an intern, which for me personally, I felt more comfortable with that because, I mean, it's a real, I don't know, just experience. The first time your pager goes off or your phone rings or whatever, and there's a doctor on the other end expecting a doctor to give them recommendations. And I was, you know, like 3 months. I had graduated from medical school 3 months 3 months before I had my first call time. She had it before me. And when that first experience happened, I was like, fuck. Like, do I know how to do this? And so, like, being, like, thrown into the weeds and, like, or, like, thrown into the fire as an intern and just, like, letting you burn, some programs do that. And, like, they don't do buddy call. We do buddy call as first years. So you're always on with your third year chief.
Yeah, I do think, like, well...
But that means that the third year is also on call. So,
yeah.
You know?
Like, well, right now, sometimes like you look at your friends like, dang, you're done with call and I have just begun. But at the same time, like, I know that we are being given more responsibility as we're becoming more and more and more proficient, given more accountability, know a lot more, able to be probably a lot more trustworthy now that I've seen a lot more, that I'm going to be giving recommendations to people. And also, like, there's not a doubt in my mind that, like, by the time I graduate, that I could literally jump into any job I wanted to, whether that was the most intense job in the world or not. Versus if you're ending off your third year with almost no call, well, again, I will be very jealous. Ask me next year, and I will hate my life. But I do know at that time,
Ash and I have very different feelings about call.
I do know at that time that, like, I'm gonna feel a lot better about whatever job I'm going into because I've been in the rhythm of it for 2 years straight, you know, versus other people.
You just get good at it.
It's gonna be
and you learn how to wear it. Like, it phases you much less. You're far less stressed about it. You feel more comfortable with the recommendations you're giving. And ultimately, the care that you're offering is just better. So that's something that you could ask them about. You know, like, do third years take call? Is there buddy call for the interns? Like, intern responsibilities. How quickly you are just on, like, hitting the ground running. You know, those kind of things would be reasonable questions to ask at a fair type setting. What else?
Okay,
Should we
let's
look
sit
at the
down
questions?
now.
The questions?
Sit down and
Sorry,
read.
if anybody needs to leave, like, we will not be offended whatsoever. We obviously started way late. This presentation is also quite lengthy. Whatever you guys need. It's fine.
Does anybody have any questions? Yeah, sure.
I want to say, your students, I'm still learning about
I think so. I do think, at least when I rotated there, I was in the OR every day except maybe like 2 days. So and like I said earlier, I don't think that the clinic experience as a student, I really see no value in that whatsoever, especially like once you get to your externships. And so spending a lot of time in clinic during those rotations, like it's no different than what you're doing in the Shoal clinic. You know what I'm saying? So I do think that it gave a very good concept of what the OR experience is like. We don't make you come in, like you don't cover call, or like we never bring you in on a weekend. There are some programs that do that, which that honestly would give you a much more realistic concept of what it's actually like to be a resident. But as students, you have other things that you need to be doing. One, just enjoy your life, enjoy your externships. You're not paid to be here, so why would I make you come in the middle of the night for some bullshit infection? Like, no. And like, yeah, having you come for like the regular OR days, which was what my experience was, great. And you get to see what the residents are doing in the OR, what kind of cases they're doing. I think that's all very, very important information to gather as an extern. But the other stuff, you just gotta get a read on like how tired that resident is. And, like you can ask them, you can ask like, hey, like, oh, you're on call, so how was your night? What happened? And, like they can fill you in on what happened, but you don't need to be there for that. You'll get it later. There's no reason whatsoever for you to be doing that as a student, in my opinion. I know Ash agrees with that too, but
Yeah. I mean, so to answer your question, like, obviously you don't see our full day.
Mm-hmm.
That's definitely, yeah, that's true, that you're just going to come for the OR. You will love that as a student, though. That will not be a problem for you. Obviously, like, yes, there is a bigger picture to it. We are coming earlier than you. We are leaving later than you. But I would say, like, the best thing I think about the program is that it attracts a lot of people who are just going to be real with you. Like, if you want to know, like, they will tell you, right? And I also think that we just get really good at, like, handling difficult situations and stress where, like, we don't need students to surround with us. I don't need a student to come with me in the middle of the night. Like, I think that I really appreciate about this program that, like, I felt like my time was really respected as a student, and that's something that I try to carry on now as a resident. Like, either I'm going to keep you to teach you something, or I'm going to send you home. I'm really not going to keep you around to watch me write notes or...
It infuriates me.
Yeah, like that's not your job as a student.
Right.
And like that's something that, like, if you see people doing that to you in externships, like,
it means that they're not thinking about you.
Like them.
Like, at least, like, to me as a resident now, like, now that I'm on the other side of it, it means, like, it's very easy for us to just, like, because we have so much we need to do, to forget about what else is going on. But if that resident has no respect for you and your time, like, that was just, because obviously you got things to be studying, like you have boards, you have interviews, like there are other things that you can be doing, if not just enjoying your life outside of that hospital, because your life will be extremely limited to that hospital once you are in residency. And so if the resident is making you sit there while they're doing their busy work and, like, whatever, there's no reason.
So, like, you can always inquire about, like, how many inpatients do you usually have? What's your normal load of inpatients? It's
a good question.
Like that kind of stuff will give you a good idea of what you're kind of looking at. But, and also, one thing I do think that you will completely see when you come as a student is just, like, and how comfortable you will get in the OR. And that's something, as a student, I really appreciated. I feel like after this program, I was like, oh yeah, I'm like, this is no big deal now.
You don't sweat it at all.
Versus, like, before that, I think I was always still pretty, like, oh, am I doing the right thing in this moment? And is that okay that I just did that? I don't know, blah, blah, blah. But after I went there, I was, like, in the OR so much that I was like, oh, like, this taught me everything I needed to know about how to be comfortable in an OR, how to be helpful, that I could actually, for once, focus on what I'm learning.
Yeah.
Versus before that, you're so focused on did I put my gown on right, and are my glasses on my face, or are they not? I don't know. Like, it's just like you're so worried about the other things, but this will teach you how to be, that becomes no big deal, and then you can actually learn.
Mm-hmm.
Yeah.
Sorry, did that answer your question?
No, that's great.
Okay.
Are there any other
What else?
questions? Pooja.
So, like, what are some ways, or like, what do you expect from us as students externing? Like, what's some ways that we can like shine
Mhm.
versus like, what are like some red flags you'd see like a student and be like, oh, maybe they're not a great fit for this program?
I'm just gonna say number one like red flag for me. Now that I'm on the other side, when I was a student, sure, I had burning questions that I wanted to ask these residents. Okay. If a resident is doing this, don't ask them questions. Okay. Sure, they might still answer you and give you a bona fide answer, which if a student asks me questions when I'm doing my work, the notes, whatever, orders, whatever it is that I have to do, and they ask me a question, yes, I will stop what I'm doing and I will answer that question. But it really aggravates me because we have so much to do. So, like, there is appropriate times to ask questions, and asking questions is a great thing to do. I ask a ton of questions, always have, continue to. It's the only way for me that I can learn. Like, if you don't understand why somebody's doing something, how do you translate that into like valuable knowledge? If it is a stressful situation in the OR, meaning like, okay, I don't know, it's a flat foot reconstruction or some more involved procedure, even if it's a hammer toe and things just don't seem like they're going as they should, and you will pick up on these things fairly quickly. If things just are looking a bit more tricky for that resident or the attending, don't start probing questions about like, oh, what's going wrong here? That's not the time. Sometimes it's never the time. But like trying to gauge how the attending is interacting with the resident. If the attending is asking you questions, that then like gives you feedback that, okay, this is a person that I can ask questions to. Like if they're just like, hey, how you doing? And then go about their business, probably not going to ask that person a lot of questions. If you're with a resident that is engaging you and like, showing you films before a surgery or that sort of thing, that is a resident that wants to help you learn and teach you. But that can all go out the window when things start going awry in the OR and things aren't going as they planned. Now, log those questions in your mind and talk about it after. Just knowing, reading the room. If it's real stressful, just wait. Don't, and like, if it's stressful, like that's also a situation as a student that you might pull back on how much you are offering your hands as assistants, whether you're retracting or dabbing, or never suction in an arthrodesis site unless they tell you to suction there. That's easy. Don't suction soft tissues. Dab them with a Raytech or a lap, okay? Sorry, this is getting really off topic.
Yeah,
but
okay, some green flags. We're going to stop that.
Yes, it just keeps going. It just keeps going.
Okay, so it's really not rocket science, and that the
Yes.
main things that make you look good are your soft skills. You show up on time. And I know that life happens and like everyone has situations sometimes you can't control, but just communicate that with people. But if not, if you can, you should always be on time. And because that's something I find that I notice a lot now in students, because the way that we view ourselves is often the way that we view other people around us, right? So if you're going to a program and you want to impress them, you better be doing what would make you proud of yourself too, right? So be on time. I love when I don't have to explain things twice to someone. If I see them writing it down and then they do it that way the next
Carry a
time,
little book.
amazing. And it is so noticed. The easier, like, and this again won't make any sense until you are a resident, but you'll hear it again and again because it's true. The easier that you can make their lives, they will love you.
Yes.
I don't care if you get every question wrong. I don't care at all. That means nothing to me. I care that, like, okay, wow, they set up that room for me exactly the way that I showed them, and now I don't have to worry about that. Now I can go worry about putting in the million orders or the notes or the BS that I have to do because I trust you that you're going to have it ready when I come back. So writing things down is extremely important, and yeah, not having to be told 2 times to do something, you know? And then also something as a student that just take it seriously for every externship, as annoying as it is and as much time as you don't have, put so much effort into your presentations. Do it. I promise you it will take you so far. Even at programs where you feel like I think I did a good job, but I don't totally know how they're perceiving me right now. Maybe I could have done a little better. If you kill that presentation, everything, so much can change for you, and they will really respect that. I found that to be very true on my externships where I was like, I think I did a pretty good job. And then I would do a really good presentation. Suddenly everyone's treating me differently. And I could feel the palpable difference. So take those things seriously. Don't just give like a BS presentation because you just worked on it for like the one day before. Like, take the time to do it and they will remember. Those I think are 3
One thing
important
on
things for me.
presentations that I don't think is highlighted very well is what is a good presentation. Most of the programs out there, at least all the ones that I went to, very surgical heavy programs, they care about the research. Like, essentially, the attendings are using your presentation, one, sure, to assess your ability to evaluate that certain topic and create an answer to whatever their question was, but also it keeps them up to date on literature review. So if you provide a great lit review, and by that I do not mean summarizing the entire paper on a slide with words. I mean, like Dr. Jaffe does, there is a picture of the title of the article with the journal and the, the author's names, and then you talk about it. Sure, you might have a few words on that slide that summarizes 127 patients, and then 2 or 3 main super brief points that are the conclusion, main findings from that research paper, so that they can actually see that in words. But ultimately, don't put the methods up there. Don't put if there's a great table that you want to highlight some of those results, put that on a slide. Pictures, fantastic. Words, keep those limited. The more words, the more likely you are to just read off of that slide. If you read off a slide, automatic points being docked. People hate that. They want to feel that you read those papers, that you know that you actually are understanding the topic, that you can explain it in your own words. Half the time what I would do with my research, when I'm doing these lit reviews, I create my own little meta-analysis, systematic review type table, and I summarize all of the results of the papers that I'm talking about in one slide on one table. And then once I go through those results, then I have a summary where I'm I personally averaged, this is how many patients, this is the, percent complication of whatever complication I was talking about, or, it will make more sense when you actually have a topic that you're talking about. But if you put the time in to do that, the amount of compliments and wow, that was a great presentation, you really seem to understand that topic, yada yada yada. And really, I'm usually starting these presentations a weekend before. She probably was much better about this than I was, because she's great at presentations. But if you do that, theoretically you could do that from the abstracts, but still have read the papers. But then it just really looks like you put a lot of time in, and you created this and work that information into your own model to give to them. They love that shit. What else?
That was really great. Anybody else?
really appreciate you guys. I can't believe you're still here.
Well, we appreciate you guys coming out here, and thank you so much for your time. Seriously.
Yeah, any other you have our emails. Both of them are up there. If you think of any other questions, you can always email us.
That's perfect.
Yeah.
We're going to have Dr. King in our next SLAM surgery session, either in September and October. It's going to be over Zoom. So if you have any more questions directly for a director and something along those lines, then we'll be bringing her in. So thank you both so much for your time. Thank you for coming out here. We really appreciate you.
Thank you guys for coming.